Hello, my name is Sue Thompson and I'm a specialist urology nurse. I'm here to give you information about your procedure so that your written informed consent can be obtained. You're going to have biopsies of your prostate, either due to a raised PSA blood test reading or an abnormality felt in the prostate, or both. It is likely that you have also had an MRI scan to look at the prostate more closely. This procedure is performed through your back passage whilst you are awake and takes about 5 minutes to perform. You will be asked to lie on the bed on your left-hand side with trousers and pants to your knees, and you will be given a sheet to cover you. You will then be asked to put your feet together and raise both of your knees up towards your tummy, and the practitioner will make sure you are positioned correctly before they begin. When you're comfortable, the practitioner will feel your prostate first to see if there are any obvious lumps or bumps to target during the procedure. Once this has been done, they will then insert the rectal probe. This is about the size of a finger, but it has an ultrasound scanner at the end of it that shines through your back passage and shows the practitioner a picture of your prostate on the screen. When your prostate is in good view, they will give you a local anaesthetic injection either side of the prostate, measure the size of the gland, and then take approximately 12 biopsies. There are risks with this procedure, and I will now go through them with you now so that you are fully informed. Firstly, there is a high risk of infection in your waterworks, as the practitioner will be going from a dirty back passage to a clean prostate with a needle. That is why you are given antibiotic tablets an hour before the procedure, and you will also be sent home with a course to take for the next 3 to 5 days. It is also highly recommended that you drink 2 to 3 pints of water each day once home, as this helps to flush out the bladder and reduce the risk of infection further. All the instructions for the antibiotic tablets will be given to you before you go home. Secondly, there is a risk of bleeding. This is most common in your urine and lasts anywhere between 2 days and 2 weeks. Your urine can be quite red to start with, and if it does last as long as 2 weeks, it can come and go, so please do not worry, as this is expected. This bleeding is another reason for drinking plenty of water. Bleeding from the back passage is not very common. You will be provided with a small pad between your cheeks in case there are any drips, but it is more likely you will only see blood this way when you have your bowels open for the first time after the procedure. There is also a risk of blood in your semen, and this can last for a good couple of months before settling. It causes a discoloration, and although it looks abnormal, it is not harmful to you or your partner. Lastly, there is an exceedingly rare chance that you will not be able to pass urine after this procedure. That is why you will be asked to pass urine in a bottle before you go home to make sure you are in working order. Once you are back home, if you experience a high temperature, get noticeable pain or discomfort when peeing, or you are unable to pass urine at any time, then you must seek medical attention as soon as possible. Please do not hesitate to ask any questions that have not been answered in this video before the procedure starts, as the practitioner will be able to answer them for you. It is difficult not to worry when having any procedure, but the practitioner knows what they are doing, so just let them take control and you will be fine.